Welcome to SAT2 Career 2.0 online nursing channel. In today's video, we are going to discuss 50 most important questions for ESI staff nurse exam and Safdarjung nursing officer exam. These questions will be very useful for you. Please subscribe to SAT2 Career 2.0 online nursing channel before going to today's video. Also click the bell icon to get the latest updates about our new videos. Let's see the first question of the day. Bilirubin is formed from option A heme, B globin, C transferrin, D gastroferritin. The correct answer is heme. Question number 2. Lifespan of fetal RBC is option A 80 days, B 5 to 7 days, C 120 days, D 100 days. The lifespan of RBC is 80 days. Third question. Which of the following is a most mature normoblast? Option A orthochromic normoblast, B basophilic normoblast, C pronormoblast and D polychromatic normoblast. The correct answer is option A orthochromic normoblast. Fourth question. The best test to assess the prognosis of the patient is option A osmotic fragility, B hemoglobin level, C packed cell volume, D erythrocyte sedimentation rate. The right answer is option D erythrocyte sedimentation rate. Question number 5. Tissue injury followed by acute inflammation and marked neutrophil reaction leads to option A resolution, B fibrosis, C suppuration and D is chronic inflammation. The correct answer is suppuration. Question number 6. The chief regulator of immune mechanism is option A plasma cells, B helper T cells, B option C is B lymphocytes and D is suppressor T cells. The right answer is helper T cells. Question number 7. Nurse should recognize that a patient has coronary artery disease receiving acetyl salicylic acid aspirin. The action is A. It relieves pain, B. It reduces fever, C. Diminishes inflammation and D. Decreases platelet adhesion. The right answer is it decreases platelet adhesion. Question number 8. The process of tightening of the fibrin clot in such a way that the ruptured area of the blood vessels gets smaller and smaller, thus decreasing the hemorrhage is called as option A fibrositis, B fibrinolysis, C synarthrosis and D synesis. The right answer option D synesis. Question number 9. Normal bleeding time is A 1 to 2 minutes, B 1 to 4 minutes, C 1 to 3 minutes and D 1 to 5 minutes. The right answer option C 1 to 3 minutes. Question number 10. Clinical manifestations of anemia includes all except option A low HB level, B fatigue, C hyperactivity, D lassitude. The right answer option C hyperactivity. Question number 11. If medical treatments fail, which of the following invasive procedure is necessary for cardiomyopathy? Option A cardiac catheterization, B coronary artery bypass graft, C is heart transplantation and D intra-aortic balloon pump. The correct answer is option C heart transplantation. Question number 12. A client experiencing diarrhea as a side effect of chemotherapy. The nursing diagnosis that should receive the highest priority is A. Fluid volume deficit, B. Impaired skin integrity, C. Body image disturbance, and D. Activity intolerance. The highest priority nursing diagnosis is option A. Fluid volume deficit because patient has diarrhea. Question number 13. The nurse reviews the ABG values of a client. The result indicate respiratory acidosis. Which of the following values would indicate that the acid-base imbalance exists? Option A, pH at 7.48. Option B, partial pressure of carbon dioxide of 39 millimeter per mercury. C is pH of 7.30 and D is bicarbonate of 24 milliequivalent per liter. So the condition pH of 7.30 says acid-base imbalance is present. 14th, a nurse is caring for a patient with a cast on the right leg. Which of these assessment findings would most concern the nurses? Option A, the capillary refill time is 2.5 seconds. Option B, the patient complains of itching and discomfort. Option D, Option C, the cast has foul smelling odor, and D is urine output of 30 ml per hour. So the most concern for the nurse will be option C, the cast has a foul smelling odor. Question number 15. Scheduled dose of digoxin is withheld and notify the physician when the adult patient's pulse rate drops below option A 50 per minute, B 60 per minute, and C 70 per minute, and D 80 per minute. When the patient blood the pulse rate reaches 60 per minute, then we can withhold the digoxin. Option B is the right. Question number 16. Rapid infusion of insulin causes option A hyperkalemia, B hypokalemia, C hypernatremia, D hyponatremia. Rapid infusion of insulin causes the right answer is hypokalemia. Question number 17. A nurse is expected to find all the symptoms in Guillain-Barré syndrome except option A hypertonia, B areflexia, C paresthesia, and D urinary retention. So in case of Guillain-Barré syndrome, hypertonia will not be present. Question number 18. A patient is scheduled for intravenous puncture using a radiopaque dye. Which of the following assessment is most critical before the procedure? Option A, history of intake and output. B, measurement of baseline peripheral pulse rates. C, measurements of heights and weights. Option D, history of allergy to iodine. The right answer is option D, history of allergy to iodine must be obtained before injecting a radiopaque dye in patient. Question number 19. The most common early symptom of hepatitis A is option A loss of appetite, B abdominal distension, C ecchymosis, and D shortness of breath. So most common early symptom of hepatitis A will be loss of appetite. Option A is right. 20th question. Distended abdomen and absence of bowel sounds after abdominal surgery indicates option A intussusception, B paralytic ileus, C hemorrhage, D ruptured colon. The correct answer is the absence of bowel sound and distended abdomen shows paralytic ileus. Question number 21. Which of the following drug is discontinued before cardioversion? A is lidocaine, B digoxin, C aspirin, D amiodarone. The drug which is discontinued before cardioversion is option B, digoxin. Question number 22. Condition in which vasospasm and inflammation of the upper and lower extremities is termed as A. Raynaud's disease, B. Berger's disease, C. Decubitus, and D is both A and B. The right answer is vasospasm and inflammation of upper and lower extremities is present in both condition Raynaud's disease and Berger's disease. 23. Single second heart sound S2 is a feature of option A. Eisenmanger's syndrome, B. Tetralogy of Fallot, C. Epstein's anomaly, and D. Transposition of great vessels. This is a characteristic feature of option B. Tetralogy of Fallot. 24. Minamata disease is due to the pollution of option A. Organic waste in drinking water, B. Oil spill in water, C. Industrial waste mercury in fishing water, D is arsenic in the atmosphere. The right answer, Minamata disease is due to the pollution of industrial waste mercury in fishing water. Question number 20. Next question is 25. Kegel exercise is a option A. Pelvic floor muscle exercise, option B. Shoulder exercise, C. Abdominal muscle exercise, and D is chest exercise. Kegel exercise is a type of pelvic floor muscle exercise. 26. Baby friendly hospital initiative was launched in the year option A 1991, B 1981, C 1984, and D is 1994. The right answer, baby friendly hospital initiative was launched in the year 1991. 27. Gross painless chronic hematuria is common in A. Cancer prostate, B. Renal injury, C. Hydronephrosis, D. Cancer bladder. Gross painless chronic hematuria is a characteristic feature of option D. Cancer bladder. Let's see the 20th question. Whipple procedure is the surgical management of option A. CA colon, B. CA stomach, C. CA esophagus, and D is cancer pancreas. So Whipple procedure is the surgical management of option D. CA pancreas. 29. Humidifier attached to a oxygen source helps to option A. Prevent transmission of microorganisms, B. Prevent dryness of mucous membrane, C. Prevent irritation on the skin, and D is prevent fire hazard. The right answer, humidifier is attached to for the purpose of to prevent dryness of mucous membrane. 20. Now let's see the 30th question. Therapeutic blood lithium level is option A 30 to 50 milligram per liter. Option B is 13 to 20 milligram per liter. Option C 0.8 to 1.2 milligram per liter, and D is 2.0 to 4.0 milligram per liter. The right answer is option C 0.8 to 1.2 milligram per liter. Question number 31. Position used during pleural tapping is option A orthopenic, B supine, C prone, and D niches position. The correct answer, in pleural tapping we provide orthopenic position for the patient. Question number 32. Image based question. Name the instrument in the following image. A. Patient sling, B. Patient hoist, C. Recline lift, and D is patient walker. The image shown in the picture is patient hoist. Question number 33. Following an accident, client is admitted to a healthcare facility. The type of admission is option A, routine admission, B, therapeutic admission, C, emergency admission, D, accidental admission. So the type of admission for this client who met accident will be, yes, emergency admission is made in the clinical facility. 34. Leakage of urine due to weak bladder muscles or to blockage when the bladder becomes over-distended is known as option A, stress incontinence, B, urge incontinence, C, overflow incontinence, D, functional incontinence. The right answer is option C, overflow incontinence. 35. Image-based question. The structure shown in the photographs develops from. So the vertebra is developed from option A, ectoderm, B, mesoderm, C, somite, D, endoderm. The right answer is option C, somite. Question number 36, image-based question. This equipment in the picture holds the rib during rib resection. Name it. A. Alice, B. Cochas, C. Babcocks, D. Debakis. This equipment shown in this picture, which is used in rib resection procedure, is Kochas forceps. Question number 37. Most appropriate nursing care to a patient who has been diagnosed as having thrombophlebitis is option A. Elevate client's leg 90 degree. B. Apply heating pad to the involved site. C. Instruct the client about the need for bed rest. Option D. Provide active range of motion exercise in both legs. The right answer, option C. Instruct the client about the need for bed rest when the patient is diagnosed with thrombophlebitis. Question number 38. The severe weight loss accompanied by progressive weakness, loss of appetite, and anemia that is usually associated with advanced cancer is called A. Carcinomatosis, B. Cachexia, C. Anaplasia, D. Dysplasia. The right answer is, so these conditions are associated with advanced cancer called cachexia. Question number 39. A 52-year-old male client is admitted with chronic obstructive pulmonary disease. The nurse notes that he has neck vein distension and slight peripheral edema. These signs indicate the onset of option A, cardiogenic shock, B, cor pulmonale, C, left-sided heart failure, and D is pneumothorax. The right answer, when these symptoms are presented, particularly neck vein distension and peripheral edema, the nurse suspects for cor pulmonale. Question number 40. How frequent should the nurse monitor the vital signs of the patient in the recovery room? Option A, every 15 minutes, B, every 60 minutes, C, every 30 minutes, and D is every 45 minutes. The right answer is, the nurse monitors the vital sign of a patient in recovery room for every 15 minutes. Option A is right. Question number 41. Principles underlying radiotherapy is option A. Malignant cells are more sensitive radiation than normal cells. B. Resistance to normal cells is increased. C. Radiation may cause metastasis. And D. Radiation kills the organisms. So the principles underlying radiotherapy is malignant cells are more sensitive radiation than normal cells. Question number 42. Which of the following clinical assessment a nurse should expect while caring for a patient with pemphigus vulgaris? Option A, skin lesions. B, infertility. C, blisters filled with fluid. And D is both A and C. So in patient with pemphigus vulgaris, the nurse expects for blisters filled with fluid. Question number 43. How many microdrops are there in 1 milliliter? A 60, B 15, C 30 and D 40. The number of microdrops in 1 milliliter is option A 60 microdrops are present in 1 milliliter. 44. What the nurse do to assess astraxis? A. Measure the length of the patient. B. Dorsiflex the patient's foot. C. Ask the patient to extend the arm. D. Instruct the patient to lean forward. In order to check the astraxis, the nurse asks the patient to extend the arm. Question number 45. Mask-like faces are the typical features of option A. Tetanus. B. Hypothyroidism. C. Parkinson's disease. And D is Down syndrome. The right answer is mask-like faces are typical feature of Parkinson's disease. 46. A nurse is caring for an anemic patient. What finding should suggest her that it is acute blood loss anemia? A. Postural hypotension. B. Exertional dyspnea. C. Easy fatigue on exertion. And D is bradycardia at rest. So the suggestion for acute blood loss anemia will be based on the symptom postural hypotension. Option A is the right answer. 47. Frequent urination at night is option A polyuria, B dysuria, C nocturia and D pyuria. The right answer this nocturia is the right answer. Frequent urination at night is nocturia. It is not dysuria, it is nocturia. Option C is right. Frequent urination at night is nocturia. It is not dysuria. Question number 48. The normal serum bilirubin level is A zero point 1 to 1.2 milligram per deciliter. Option B 2 to 4 milligram per deciliter. C is 1.5 to 3.5 milligram per deciliter and D is 10 to 12 milligram per deciliter. The normal serum bilirubin level is zero point 0.1 to 1.2 milligram per deciliter. Question number 49. A post-operative patient develops evisceration. What a nurse should do? Option A. Provide moral support. B. Ask patient to drink more water. C. Push the protruding organs inside. And D. Cover the protruding organs. When a postoperative patient develops evisceration, the nurse should option D. Cover the protruding organs. So these 49 questions are very important. Hope you enjoyed this video. Click these two videos. You can watch more questions. Thank you again. Bye bye.